Hey Bernie, Tim Henry, your mayor here. Today is April 23rd. It feels like April 53rd for some reason. Just this month seems to drag on, but thank you for joining me for a update today. I'll get to I'm going to issue some new orders today in terms of things that we can do differently in Bernie, but I want to put a little bit of context around that before I get started. This pandemic, this worldwide pandemic, it's been very frustrating. And it's been difficult for all of us, and I know that. I know that's true for me. I'm certain that's true for a lot of you that are out there watching right now. The data and the information that has been coming out, again, it's been relatively new. It's pretty volatile. There's a lot of opinion out there. There's a lot of misinformation, and the world's been struggling. How do you get the right information on something that's moved so quickly? This virus is not Republican, this virus is not Democrat, nor is it Libertarian. This virus has spread really, really fast throughout the world. That's why the WHO declared it a world pandemic.
Speak louder.
And it's taken a toll on the medical community in a lot of places. We've seen that over the last 2 months. And in certain places in the U.S., we've seen it taking a toll on the medical community. There's no question about that. So today, I would say there's a substantially large number of healthcare experts that would say the social distancing that we've all been doing, some of it's been mandated, some of it's been doing it in practice at all times. The social distancing has clearly worked, and the spread of the virus, certainly in the U.S., definitely in Texas, and absolutely in Kendall County, has slowed, and that was the whole intent. Since the day one of these videos, it's been very clear to me from the healthcare professionals that this was not about how many people were going to die. This was about not overwhelming the medical system primarily and slowing the spread. That's what this has been about. I was reading a report this morning, interesting statistical information that's come out of New York. Out of 5,700 patients that were hospitalized, 94% had underlying conditions. And the three underlying conditions that they had one or multiple of were high blood pressure, diabetes, and obesity. On the CDC's website, they would say that 45% of adults in the U.S. have high blood pressure. Just over 40% of the U.S. is considered obese by BMI definitions, and a little over 10% of the U.S. has diabetes. That's real data. And when we look at how many people would be at risk and that have these underlying conditions, that's the reason why this has been taken so seriously by the healthcare community and making sure that we don't overwhelm, again, the hospital system. This data is real. This disease is not a hoax. We still don't even fully understand what is the path it's going to take for the next several months. We don't understand that. The doctors are still trying to figure that out. There's an opinion out there that maybe, like the flu, when the weather gets warm and ultraviolet rays hit different areas, that it will kill that virus, but that's not proven yet. So the bottom line is we're not completely out of the woods. I recognize that. I'm certain that most of you recognize that. And we'll be putting ourselves in harm's way if we don't continue to take the proper precautions. The economic impact of this has been profound, more so on some small businesses than others, especially those that had to close completely with zero revenue for the last few weeks. I've had to shut down my business in San Antonio, and I have almost 700 people that I had to furlough. I guarantee you, I'm very anxious to get back to work, but we have to do it in a way that makes sense. The governor is going to be making an announcement on Monday based on his strike force. His strike force is going to give him input tomorrow, and he'll be making announcements on how to further open Texas, again, with the right precautions in place to make sure we don't go backwards. If we go too quickly, the prevailing opinion is that we will have to probably take extreme, drastic measures again, much like we've just been through for the last several weeks. And I frankly don't want to go there. I'm certain that you don't want to go there either. So I think, being responsible citizens, doing what's right, ensuring we don't spread the disease as fast as it could spread if we don't take precautions, that's what all this has been about, completely. Interestingly, the psychological impact, from my perspective, I don't think that's been fully realized. From basic services that often made us feel good, like going to get our hair done, or going to get our nails done, or getting a massage. I know in my household, my wife is anxious for those things to happen, or to reopen so she can get back to those things that psychologically make her feel good. The me first attitude that showed up several weeks ago that prompted a lot of hoarding in the grocery stores of key items that used to just be daily household items. I view that as a psychological impact. And this morning I got a couple of emails saying, I can't even find bleach. What are you doing, Mayor, to get more bleach into our community? I can tell you, I don't control the bleach supply line. But I did send a text out to Matt and Cindy. Matt is the general manager of HEB. Cindy's the general manager of Walmart. And I asked them, can you help me understand what's going on with some of these basic items like toilet paper, like paper towels, bleach, sanitizer, hand wipes, or the basic household things to clean up with? And both of them replied back within like 2 minutes. And I very much appreciate how they've been part of our team in terms of how we address things. They both said the problem is the supplies. The suppliers are rationing what they are given to stores because they just don't have enough. Because as soon as they get stuff, both of them tell me they get some stuff in the morning and it's gone within an hour. That's still the hoarding mentality. And they would like to get more, but frankly, it's just not available. So we have more demand than there is supply. I can't fabricate more supply. So really, I think it boils down to us just being responsible, again, citizens, and not getting more than we need so that others can get what they need. I'm on a septic system, and I need to put bleach in that. And I was talking to Matt last week. I can't even find basic bleach for my septic system. Not even the fancy floral bleach, just the basic bleach. I'm sure many of you in the county have that same challenge because these are just basic necessities that all of a sudden have become really, really important commodities for people that need to hoard those things. When the governor enacted his orders on March 30th, he also put in place a disallowance, frankly, of the Texas Local Government Code 418, which allows local governments to act when there are states of emergency like we have been. He disallowed mayors and judges from making any changes that were in conflict with what he has ordered. Recall what he did on March 30th is he went to essential services only, and it's his order, and nobody can change that. Nobody can override that, what essential services are, and all essential services are to non-essential services were closed to the public. We've been having lots of conversation about how do we get back to work, and that's a difficult thing to do when we can't override that. That's just basic Texas law. For those that understand that, there's a pecking order again to what I can and can't do as a mayor, what Judge Lux can do in our county. We are bound to Texas law. So we've been working on this, and I think we may have a way to work around this in a way that's positive. I got an interesting call from a business owner here in Bernie named Vicki, and what I really appreciated about her call is she didn't call me out of anger, and she didn't call me just to vent out of frustration. She called me with a solution, and she explained how she would like to reopen her business, which is presently closed, responsibly, in a way that doesn't put anyone at risk by spreading COVID-19. And she went in great detail and was very thoughtful and very constructive for me. And Vicki, I appreciate you doing that. That's how we get solutions on the table. That's how we work together. We don't just scream and yell at each other. We have to work together. I took her information. I shared that with Bayless Miller. He's the representative from the Bernie area that's on that strike force. And I said the other day, I've shared my comments with the governor as well, to the extent that I could get those to him through whatever filters it's got to go through. And, he's going to make his announcements on Monday on how to reopen. And I can tell you with all candor, I don't know what those announcements are going to be. Could continue to wait until Monday, or we could do something today. And the solution that in working with this entire team that has been focused on this since day one, we've been I guess now 6-7 weeks, we've been meeting daily, talking about COVID-19, how do we respond as a community. I've interacted with a lot of those people over the last week or more, talking about how can we reopen. And today I am going to announce a way that I think that we can do something before waiting, without waiting until Monday. You know, when the governor makes his announcement on Monday, he tends to have several days between when he makes the announcement and when it goes into effect. A case in point would be last Friday. He announced that that retail centers can do retail on the go, and that would be effective tomorrow. So an entire week went by. Excuse me. In talking with Vicki, what if we could do something tomorrow that might give some people 4, 5, 6, 7 days of revenue? Would that be helpful if we could do it in a responsible way? And her answer was, yeah, that would be extremely helpful. So, pardon me, the orders that I just signed this morning, I'm going to read them to you, the orders that we're changing. So, recall we have our city orders that basically reflect what the governor has put in place. And we also have an order in there around travel. If you are traveling back to Bernie from an area that has known high community spread, you should self-quarantine for 14 days. That would just be the smart thing to do, especially if you went into an area that had high community spread and you were in their grocery store, as an example. I added 2 new orders to our existing ones. So let me read order number 2 that we are adding. It says, retail establishments that are not deemed essential services are considered reopened services and may provide service to customers by mail, by curbside pickup, by delivery to a customer doorsteps, or by in-store appointments that are in compliance with CDC guidelines and the Texas Department of State Health for physical distancing, for sanitation, and you must wear a mask. So what that means, stores that might have been deemed non-essential, like retail stores, salons, hair salons, nail salons, they're still closed to the public. Your doors can't be open and people can't just come in and hang out in your store. But this will allow you to set up an appointment and somebody can come in, and as long as you as the business owner are wearing a mask, you're doing proper sanitation. I would suggest when somebody walks in the door that you both use hand sanitizer. That way your hands are now germ-free. If you're going to get your hair cut, the person having their haircut ought to be wearing a mask. When it gets to the points around the ears and you need to take it off briefly, take it off, but the person cutting the hair ought to wear personal protective equipment. Certainly, if you're a barber or you're a stylist, a hairstylist, you're going to practice great hygiene and keep all of your equipment clean. This does not mean you can open the door and fill all the chairs. This is going to be one appointment per room. If you have a facility that has multiple rooms, great, 1 per room. But this isn't opening up and just like we were before. Practice social distancing. Of course, we're talking about a practice in hair salon as an example where you can't be 6 feet apart and cut somebody's hair. So this is going to give those people that are in retail or some of those other places a way to open your door by appointment only, then lock the door, conduct business, allow the next person to come in. The waiting room is outside in your car. The waiting room is not inside your business. Okay, order number 3. I just talked a little bit about that. Is about travel. If you're coming from an area that has known high community spread, you're strongly urged to self-quarantine so that you don't put others at risk. And then order number 4, I'm going to read this one. Although in-person visits to gyms, massage establishments, cosmetology salons, or other hands-on service establishments shall continue to be avoided by the general public because you're technically closed by the governor's orders. These services are going to be allowed on a one-on-one basis by individual appointment only to perform your service. Masks and other protective, personal protective equipment must be worn. Fitness and training-led instruction is going to be allowed in a one-on-one basis or in groups of less than 10 students, as long as everybody is in compliance with the CDC guidelines for distancing and the Texas Department of State Health rules for sanitation. And wear masks when you can. Now, when you're exercising, it's hard to wear a mask. When I'm out riding my bike or if I'm running, I can't wear a mask. I get that. What we're trying to do is do a responsible opening of some of the businesses that have been shut down and have zero revenue. That's the goal here. If we do it in a way that we act responsibly, then I would suspect we're not going to see a rapid change in the number of cases that we have in Kendall County. Today we have one active case. At our peak, I think we had 10 active cases at once. Again, those numbers were small, but I believe the social distancing has worked. So we're not throwing the social distancing out the door. We need to still abide by these rules. We are not opening up everybody's doors to be back in business. We're doing it by appointment only. This will allow some people to, hopefully you were a great tipper with your hairstylist before, because I'm certain they'll answer your calls first. But this is going to allow some people to have that psychological benefit of going to places you couldn't go before in a one-on-one basis. These orders go into effect at 12:01 tomorrow. That means for those business entities that this affects, that allows you to have one-on-one appointments, you can start making appointments today, and you can be open all day tomorrow with your one-on-one appointments. Again, we're not opening up to everybody. You're still closed to the public. This is not inconsistent with the governor's orders. We have verified that. In fact, the governor has opined on this, this very comments that we're talking about. And so I feel like we can do something responsibly together. We can allow those businesses that have had zero revenue to start having revenue. And it may be for as many as 4, 5, 6, 7 days until we hear what the governor says on Monday. Now, the risk I'm running, and the risk that we're going to be running together, is if the governor does something different on Monday that creates conflict between the orders I'm putting in place today, we're going to have to adjust. I think that it's worth the risk, frankly, to allow some businesses to start having revenue, get back into business, employing people so that they have revenue, but doing it in a way that's responsible, that's compassionate, that follows the CDC guidelines and does not create undue risk in our environment. I believe these orders are going to be pretty consistent with what the governor has to say on Monday. But again, if they're not, I'll quickly respond as you've seen me do. And then what we're going to do is we're going to continue to watch the data and make sure that we aren't spreading the COVID-19 virus more quickly than we need to. I'm certain that at a state level or at any county level, this is going to be the key indicators, looking at the data and then make decisions again. I'm actually excited to do this. I hope this is going to help some of those businesses that have been suffering, and it will help some of those that have wanted to patronize those businesses. It'll give you an opportunity to make a phone call, set up an appointment, wear your mask, and do something responsibly good. And I would encourage you, when you're working with these folks that have been closed for so long, maybe be a very generous tipper at this time as well, because I know they need it. I know that's what my wife and I have been doing. Let me close with this. Following the CDC guidelines is really the right thing to do right now. And the guidelines are not that hard to follow, especially as it relates to wearing masks. You know, a week and a half ago, I was talking about if we start having wide community spread, that I didn't want to make it a mandated thing in our community, and we haven't, because the community spread didn't happen. That's a good thing. But I would encourage you, really, it's important that you follow the CDC guidelines, especially when you go to public places like H-E-B, Walmart, Home Depot. Wear a mask to protect others. It's not to protect yourself. And the wearing of the mask, it's really not that complicated. I do it when I go out. If you can't guarantee that you're going to have 6 feet between you and somebody else, just put it on for the duration of the time when you can't have 6 feet of social distancing. It's so that if you sneeze accidentally, if you cough and you're a carrier, you're not spreading it out in the air. That's all it's about. And candidly, it's about respecting your fellow citizens. A lot of people have written me many emails and lots of comments that they view others who are not wearing a mask when they're out in public, frankly, as disrespectful. That's their viewpoint. I think we have a caring community. I think that we have a strong community. And if we just do the right things, we won't allow this COVID-19 to spread on a rampant basis. And we can continue to getting back to whatever life as normal is going to be like in the future. That's all I have for today. I'm sure there's going to be comments and questions. You can send those questions to COVID-19 at bernie-tx.gov, and we can respond to your questions as quickly as possible. So thank you for tuning in today, and as we have more updates, as usual, I'll get those out to you as quickly as I can. Have a good day.